You will have a little icon pop up on your screen, and all you just have to say is okay.
Are we ready to get going?
Mhm.
Well, good evening, everyone. Thank you for joining us today for the Mind Matters conversation we're about to have. Um, some of you guys out there may not know me yet, but I am Javier Valdez. I am the new executive director for NAMI Central Texas, so it's an honor to be here and helping lead this conversation. Um, just wanted to let you know, introduce you some of the team putting this together. We have Richard Allen, who is our volunteer and peer coordinator, working all the technology behind the scenes. And then next, I'll introduce you to my director of programming, Anna Bunker.
Thank you, Javier. And then we can also go ahead and Kate, if you want to give a little bit more of an introduction about yourself, because you know yourself better than we do.
Hi, sure, thank you. Good evening. I'm glad to be with all of you this evening. Kate Henderson. I've worked as a healthcare executive for the last 20 plus years, most of the time in large hospitals and hospital systems. Today, I actually work in a company that works in healthcare for the home, so a little different setting. But in general, I've spent my entire career really focused on trying to improve health and healthcare for individuals and for communities. And I'm delighted to join you this evening. I'm also, on a personal note, I've been married for 23 years and I have two amazing sons, one who's 18 and just left for college, and the other who's 14 and just started his freshman year of high school. So I can talk a little bit of healthcare and a whole lot of parenting.
Thank you for that. And then Anna will be providing some lived experience perspective as she, to this conversation. And so before we get started, just wanted to let all attendees who are viewing, if you guys have any questions throughout this conversation, please enter it into the Q&A, and we'll make time at the end of our conversation with Kate to leave some room and answer some of the attendees' questions. So let's get started. Kate, would you share with us a bit about your professional background as well as your personal experience that speaks to why you were invited to share this information with our community?
Sure. I think as someone who's grown up in the healthcare system professionally, um, I know that we have a nomenclature, a way in which we do things, a language in which we use, all of which are designed to ensure that we follow safety protocols and that we follow standard of care protocols. That said, even just hearing the language that I'm using, that's pretty official language, and some of the terminology is very specific to what we do. And I know that, again, with the intention of doing the best thing for the patient, we can sometimes keep our language consistent with our medical language versus actually really connect with the patient and family. Never our intention, but often our practice. And when I think about what it means to have a mental health illness or experience a mental health crisis, I really can't imagine a more fragile and vulnerable place for a person. And then to interact with the healthcare system where we're using language and putting you in settings that are unfamiliar and maybe even scary. This was a passion area of mine when I was invited to speak, that if there's any way in which I can contribute to maybe narrating a little bit about what it is that we do from a healthcare setting, but also what it is we can do as parents or friends of parents with kids, anyone in our lives, to just help them navigate those experiences and be the best advocate for their child and their family. I'm happy to help in any way I can. So that's how I ended up being here tonight.
Thank you for that. And so now, and you mentioned, you're also a parent. So as speaking from both hats, right, of being a parent and a healthcare professional, what are some of the signs to watch and listen for, especially with teenagers?
Yeah. So, I mean, teenagers, we can say, oh, watch for sudden mood swings, and then we can all giggle about that because some of that's just about being a teenager. Um, But really, I think most of the advice and if my experience would be that looking for things that are really unusual swings. When teenagers, if they usually are talking and they stop talking for longer periods of time, um, emotional outbursts that are maybe unexplainable or different than different than you've seen in the past. Weight changes, either gaining weight or losing weight, sort of suddenly. Any other kind of sudden changes in appearance. I think sometimes we can over-explain, oh, they just have a new set of friends, or we can sort of poo-poo those things. But I think just staying engaged with your child, um, observing, hey, I noticed, and just giving them a chance to talk. Um, and then not filling in the blank for those changes for yourself, but rather really observing what they are. And I'd say stay curious. Don't assume they're bad or good, just stay curious about them.
How about you, Anna? Do you have anything from your perspective to add to that?
Yeah, absolutely. I mean, I was a teenager at one age, surprisingly, but when I was younger, I was diagnosed with anxiety and depression, which is different than the diagnosis that I receive now, which is bipolar type 2 disorder. When I was younger, I was showing a lot of signs of depression and then the anxiety added on to that. But it was kind of like a turned eye back in the day when I was in high school. Now, luckily, it is something where a lot of people are paying more attention to, whether it's friends, parents, or people within the school. I was someone who was definitely an overachiever though when I was younger because I wanted to run from my mental health and my depression. So Kate made some really great points. Those are things that you can see like at home or at school with the mood changes and things that not aren't or things that are a little bit more obvious and out of the ordinary from them. When it came to me and me trying to cope with my mental health struggles, I was trying to be perfect in school. So, having straight A's, I was in a lot of extracurricular activities like clubs. I also was part of a couple of sport teams. I did everything that I could to not sit and settle within my emotions. So, there can be two completely opposite sides of the spectrums when you're looking at teens and trying to determine like, is this something where it's just normal teen behavior? Are they an A+ student? Are they struggling? There's a lot of different components that can really come into like a sign or a symptom because it's different for every single student. Or not a student, I'm sorry, with the teen. And it kind of changes like throughout their teenage years too. What I acted like when I was 13 was just quiet and reserved. And then when I was 16, I was showing a lot of physical appearance changes where like I cut my hair off and did some pretty erratic things. So not only is it behavior, it can also be physical appearance.
So and to Kate's point, right? It's important as parents to stay curious with your kids, ask questions when you're noticing. So thank you for that. So now let me switch to a slightly different. Kate, can you provide us a high-level overview of what individuals and families can expect when visiting an ER, during a mental health crisis?
Yeah, sure. So, sort of putting my healthcare provider, I can sort of wear both hats at the same time, if you will. So, if you and a child present to, or just another person present to the emergency department, and I'm assuming that you're walking in yourself. So, there could be different scenarios. Someone else could be bringing you in. But if you're walking in yourself, let's say the school called and said, your son's been expressing suicidal ideations today. So you would assume you're walking in by yourself. You check in at the front desk. I think this is where the first point of discomfort begins because you have to explain to a front desk in a waiting room where it may not be as private as you want why you're presenting to the emergency department. And so just to make people aware of that the first thing is you need to name why you're there. And that's how an emergency department begins to triage. And if you've never named why you're there and said the words out loud, the school just called me, my son's expressing suicidal ideations, that can be a little uncomfortable. And so that's the first place you begin. Very quickly, because of that presentation, you're going to find yourself triage, meaning you move behind the front desk and you're moving into a more clinical exam area. The protocol, because an emergency department doesn't know what the family situation is or what the potential, if there is, what the root of I'm going to use self-harm as an example. The root of self-harm is they will fairly quickly separate the child and the adult. That's a very disconcerting thing to have happen, right? If you're in a loving relationship with your child and you're feeling vulnerable, and one of the first things that happens is you get separated. And you get separated so that both parties are able to be interviewed and to tell their story about why they're here. And it's meant to protect the child and give them an opportunity to share with another adult what might be happening. But it doesn't, if you are, again, in a trusted relationship, nothing about that separation is going to feel comfortable. And it might not even feel comfortable if you are in a harmful situation. So an interview process begins, right? An interview process begins, and the kinds of questions that we are trained to ask are really uncomfortable questions, right? They're questions that you may not want to tell a perfect stranger. You may not want to tell anyone. And they can be viewed as potentially like someone's judging you, right? There's no judgment in those questions. They're questions about whether you've thought about self-harm, if you have a weapon. I mean, they're going to take you through if you're being harmed at home. And all of those can feel very judgmental or very difficult. Again, they're all with safety in mind, because no one in the emergency department knows you, knows your history and background, knows exactly to the extent that you're not feeling well. So they literally go through the depth of these questions. Then case management or social workers may get involved. You might move from a nurse triage into more of like the social component of your home life, the dynamics, etc. At some point in that visit, they're going to bring you and your say likely because all of this is nuanced, but they will likely bring you and your child back together. Your child may or may not have their personal belongings by this point. They may have been stripped of their personal belongings, their phones, their shoes, their clothes, and it may have been put in a personal belonging that's a bag and tucked away. And that's, again, because those are items that could be used to hurt yourself or others. And so those items are removed, and that also can feel very vulnerable, particularly to a teenager. Someone just took all of my things, my phone, my wallet, my whatever. And then, again, this series of really kind of investigations and questioning. Oftentimes 3 or 4 people will come in and out of a room, and they're going to all ask you the same question. And they're looking for layers or different nuances, but that can also feel like sort of what's happening here. Is anyone listening to me? Are any of you talking to each other? Is there a trick going on? You're often in a room that's considered to be a safe room, so it may be stripped of and not look bare compared to maybe other clinic rooms or emergency departments you've been in. Again, safety in mind. It may not have 4 walls, meaning it may have 3 walls and a glass door, and a person called a patient care sitter, someone who is literally just sitting and observing you, may be at that door. And if it feels like they're doing nothing but watching you, it's because they're doing nothing but watching you. By design, they're designed to be there in case you or your loved one makes some sort of physical action that might cause harm to you or others. So those are, I mean, I could go on, but just to sort of give you some examples of all of those things aren't things we're usually accustomed to. Kind of the line of questions, the number of questions, the layer of questions aren't typically an experience most of us have had before. And again, while my own experience sort of going through it with others, and as a parent, as a friend of parents, I try to, walk with people through this. I always think, oh, you're a healthcare professional, you know how this works. I do technically, but when you're sitting there sort of observing a friend getting asked these questions, you start to really deepen the humanity of it and realize the level of discomfort being asked these questions, even though I know all the reasons why those questions are being asked.
Anna, would you like to add anything to that?
Yeah, for me, working within the mental health field, but also being someone who lives with a severe mental health condition, I absolutely see both sides of it. I get the best of both worlds. I think that I can understand the questions, but also like I get the viewpoint of why it can be a traumatic experience coming into a mental health crisis or an emergency room or anything along the lines of that, whether it is something that you do voluntarily or you don't voluntarily go into an emergency room or anything along the lines of that. When you are being asked these questions, you are in such a distraught state that it's really hard to see the logical aspect behind why are these questions important? Why are they asking these questions? I feel like I am very much, like Kate said, being judged. When we are coming into a mental health crisis, sometimes we just completely like black out. It is something that very much happens where it is very hard to even control like our thoughts, what we're saying, like our body movements and that sort of thing. So sometimes healthcare providers and having that interaction isn't always like seen through nicely. It can sometimes cause a lot of extra additional emotions with the patient that is in. So I can see it in all ways, but I think it's really important for people to know that even though we're going through a mental health crisis and that is traumatic enough, us coming into the emergency room and going through those questions and those interactions can also be an additional traumatic experience on top of that.
Thank you, Anna. And so along those lines, Kate, you've shared some of the, things that you can expect. Are there other common challenges or concerns that people may face when taking a loved one, especially a teenager, during that process?
I think a lot of it is it's sort of the experience of you are in crisis, you and whoever you're with, and it's the fear, the waiting and the unknown. I wish I could tell you that, every emergency department does this beautiful job saying, welcome to the emergency department. Here's, sort of says, here's the run of show today, and actually explains to you these different process steps, but that doesn't happen. And so you're left waiting, separated or together, sort of a what's next. Oh, the next person's coming. And so you're already, in an unfamiliar place. There are unusual noises, bright lights, you're being watched, you've been stripped of your things. This sounds really lovely, doesn't it? And you're anticipating what's happening next. And the next step could happen in 5 minutes or an hour and a half. Because an emergency department by design is triaging all the other patient care needs coming in. And so I would tell you, I think that know that if you and your loved one need to go to an emergency department, first thing is you are now safe. That's true, right? So like in terms of the positive, you may not be comfortable, but you are safe. And that's why you went there, and people are going to help you. I would say also, like, this is complex. And so the reason folks are taking their time, multiple people are asking questions, is because it is complex and everyone's situation is different. And we often talk about, why can't I have personalized care? Those layers are actually deeply trying to deliver personalized care for what you and your loved one need. But because of the complexity, it takes some time. And so I know when I've sat with friends and gone through that process, again, even though intellectually I understand that, I needed to really remind myself, okay, what are the positive things here? I am safe. My friend is safe. My friend's child is safe. We're going to get help. And they're taking their time, because it's not like setting someone's forearm that's been broken, right? See the x-ray, it's broken, cast it. It's not that simple. And so if we can remember that, and then also I would encourage folks, call a friend. You don't have to be there alone. You can call folks. You can, if you've got someone in your life, and just say, I needed to talk to someone, and do that. Draw on your community to talk with them, because you need that kind of support, because it is a really foreign space. So those are some thoughts I have, I guess, regarding that. But it is challenging. I'm not gonna, as you hear me say, I'm being pretty honest about it. But it is a very safe place, and people are there to help you, and that I feel very confident in.
So Anna, Kate shared some of the things people can do to prepare, to visiting an ER. Is there other things that you might want to add to that, to inform people what they can do to kind of lessen that anxiety as they're approaching an ER facility?
Yeah, I think you can only do so much to prepare for a traumatic event. And you can only do so much to prepare for a crisis or anything along the lines of that. So like, you can come and educate yourself about what to expect when going into an ER and so on. You can have all of your medications laid out. You know them by heart with the milligrams that you take. You can come with your diagnoses. You can come with basically anything that they're going to ask you with questions when you get to the ER. But that doesn't always mean that you're emotionally and like mentally prepared to step into that setting. And there's not always a way to prepare yourself. For me, when I go into a mental health crisis, one, it's hard receiving help because I feel like a failure in a way where it's like, I want to do this, but now I have to surrender myself and my illness to get help. And like going to the ER, that's an example of that. I always try and tell myself, like, you know what? I am very distraught right now. I may not understand what is going on, but they're doing the best of their capability to help me to make sure I am safe. I did a lot of background education too when I was diagnosed. Like Kate said, the different room setups for mental health and psychiatric rooms. There's also different setups like no strip corners, door handles, a lot of different things like that, where you think that your personality is like being stripped, like you're going to jail or something like that. But those things are in place to help keep you safe. And it's really hard to see that. So I have always just done a lot of self-talk, like you're safe. They're trying to help you. I know it doesn't seem like this now, but you'll see it on the other end. Um, Other people may handle it differently, but yeah,
Yeah.
you can only do so much to prepare. It's not something that you can like have a box lunch and prepare to have like dinner and lunch at like certain times during the day. It doesn't work like that.
Yeah. Thank you, Anna. And so, Kate, you had mentioned some of the things when, the check-in process that you get separated. Are there, such as that, are there other key aspects of that ER admission process that attendees should be aware of?
So as it relates to school-age children, and I was not aware of this until recently. I visited the emergency department with a friend and kiddo, and there's also a whole set of paperwork and process that's both related to the emergency department but also related to the school, because once you've had a kiddo in the emergency department for a behavioral health need, then there also needs to be a connection with the school. That this is a good thing. But there's complexities there too. It's already hard enough to understand sort of what happens next in the healthcare system, and then how do I connect that with follow-up and with the school. And schools are fairly inflexible when it comes to this, again, with safety in mind. So I think I would be prepared to ask a lot of questions, ask about next steps. Don't Sometimes in healthcare, we give the impression we don't have the time to answer all your questions. People are busy. Remember that downtime I mentioned in between when people are in and out of your room? Take time, maybe even ask for a pencil and paper and just start to write down those questions you have. And I think that when you present a healthcare professional with, hey, I've had some time to think about my questions, I wrote them down, you're going to have more of their attention, right? You can actually go through your list. So I would encourage that. It also will help you, sort of begin to think about what's happening, what's going to happen tomorrow, what's going to happen this evening, and just also help you maybe begin processing. I saw that as being really effective in terms of capturing those next steps and kind of getting out of the chaos of the moment, because it does feel like that there's a lot of kinetic energy of people in and out of the room. But that downtime can be used to capture those questions and then thoughtfully interact about what's happening next in this visit. What does going home tonight look like? What does interacting with the school tomorrow or the next day look like? Because you ideally do get to reintegrate shortly.
And you bring up a good point of, taking the time to gather yourself. Obviously, communication is crucial in such situations. Do you have any tips on effectively communicating with healthcare professionals and to be able to advocate for appropriate care?
Yeah, definitely. So I do think the writing down your questions and is helpful. I think that so I've seen people, irregardless of generation, sort of defer the healthcare professionals, even when the healthcare professionals are using language that we don't understand. And so keep asking, say, I don't understand what you mean. I've never heard that word before. And so I think, or in healthcare, we practice read back. So you say something, I would say, hey, I think I understood. Let me read that back to you. And I'm going to read it back to you in a way that I thought this is what you just said, and have them confirm. We're very used to read backs. We do that all the time in healthcare. So read it back to them. I heard you say, is that correct? Healthcare professionals, depending on the presentation, are often going to, we're risk managers, right? What are we trying to do? We're trying to mitigate the risk of your child getting the disease process continuing and or the kiddo being unsafe sort of out in the free world. And so we're going to tend to overcorrect in that risk management situation. Now, these are serious situations. I would say remember that if a healthcare professional says, I think I need to keep your child overnight for observation, you have to agree to that. You have to agree to that. And so I think being thoughtful, asking questions, saying, well, tell me a little bit about that. Like, I wouldn't take that lightly. As a parent, I would never take that lightly, because as Anna is highlighting, this is already traumatic experience. Now you're going to separate my child and have them stay overnight in a hospital. That may very well be medically appropriate or not, but they're going to lean towards, a risk management approach. And so I would ask questions. Well, tell me a little bit about that. What do you hope to observe overnight? What's the reason you want to observe? What would change between tonight and tomorrow morning that it's just an observation overnight? If we didn't want to admit my child tonight, how could I keep him or her safe this evening, and maybe have a follow-up appointment in the morning? So I think, right, there's a number of different scenarios. If safety is the goal, which it is, think through that, and don't be afraid to advocate for you and your child, because none of these experiences are easy, and you likely know your child more than anyone else who's just met him or her. And I'd say advocate for that, all the while knowing this is very serious and it's all about safety. So whatever environment you think is the safest and accomplishes the goal, but so advocate, lots of questions.
Absolutely. I do have something to add, like, into that from the peer perspective. Living with bipolar disorder, I see a lot, or I have seen a lot of different mental health professionals, counselors, therapists, whoever along the way, that has helped me within my treatment plan. And Kate made a really good point that your child and the situation best. So like for me, I always have to advocate for myself and my diagnosis and what care has worked for me these last like 10 years being diagnosed with a mental health condition. You are the person that knows yourself best. You are the person that knows the situation best, and learning how to advocate for what may be good and what may be not good. It's something that can really like turn the tables, where you can have that positive, safe outcome and kind of de-escalate the trauma that you may experience, such as, yeah, like Kate said, the child staying overnight, to be observed. Like, is there something that would be better suitable for the situation?
That's great advice. And I mean, and along the same vein, what about for parents and caregivers? What guidance can you provide them on helping their teens or adults in crisis feel more at ease during their ER visit during a crisis?
Yeah, and this in my mind goes back to, remember that everything is happening is not a personal judgment. It's going to feel that way. Every person I've ever walked through this journey with, I thought, oh my goodness, it's a protocol, and they're running the protocol because they don't yet know you or your circumstance. And so the only way that they can operate the safest way is to ask all these questions. And in healthcare, they've seen everything. There's really nothing we're going to shock most healthcare professionals with. And so whatever the answer is, it's okay. But I think just know. So I think for me, when I've been with folks, it's making sure they know they're going to ask hard questions. But remember, they don't know you. They're just asking. So whatever that answer is going to be okay. Also, some kiddos don't know this is a confidential place. So whatever you tell this healthcare provider, that's it. Like, this is where it stays. Like, it's not conversation. It's conversation in this room and with your healthcare provider team. It's not something that folks are going to share beyond that. So I think reassuring folks that that's really helpful.
But you, Anna, anything to add there?
I mean, I think Kate did like a really good, like, overall, like, standpoint of it, because like it is protocol. Like, we all have protocols for different jobs, different fields, all that sort of stuff. Protocols are in place so we can make sure that we're doing things correctly. I do also want to jump back to when Kate said a lot of people do take it personally when they are in crisis and are going into the ER and getting asked all these questions. I think it's really important for the healthcare providers to communicate, like, I am asking these questions because it's protocol because I want to get to know you better to understand what's going on. It may seem like these are just questions that I need to check off, but explaining that it helps get from point A to point B and then out to figuring out what a best treatment options for that person. I think that would be really beneficial for people to hear because sometimes it can just feel like I'm checking off the list, I'm checking off the list, I'm checking off the list, and like I'm not someone that they want to take consideration or actually get to know about what's going on with me.
Yeah.
And Kate, you had mentioned obviously to ask, don't be afraid to ask questions, advocate. But in your experience, what can you share that, how can attendees work collaboratively with their healthcare providers to ensure the best possible outcome for their loved ones, their mental health needs?
So I think healthcare providers are going to come up with a recommendation, and it's sort of a recommendation, like I suggested. Like they might say, we really want to observe your child overnight, and so that's where I think we can say, well, help me understand that, right? Ask some more questions, and it can be with the goal of like, I understand you want to you want to help me and my kiddo. You want us to stay safe. I'm not sure that's the best route, as their parent. I'm not so sure I agree with that. So can we collaborate on the treatment plan versus you make a recommendation and us be at odds with each other? How can we work together? What might that look like? And I've even been in a situation where I've suggested an alternative. Hey, I have an alternative. You don't know me, but in my house or in my friend's house, here's something we could do. Here's something we could commit to. I don't want to use the word negotiation. It sounds like that, but it's a little bit of a collaboration because they also don't know what you're able to do or the parent's able to do and what the situation is. So I think that's helpful. I've also had a situation where with a friend, and the kiddo started to well, what was reported, because the adults were in a different room, the kid was in the room with the clinician came and reported to us as adults, the child is escalating. I've asked the child to start completing his safety plan, which is a plan like, how are you going to stay safe when you leave here? And the child's escalating. And so the parent and I looked at each other and said, that's surprising to us. And so I said to the clinician, I'll tell you what, could we give it a try? Like, can we go sit with the child? And she said, oh, well, I'd have to observe. And I said, okay. But I just wonder if he'd be more responsive to us talking with him about the safety plan. So we were allowed to go in the room with him and sit down. And I narrated it using a teenager's language. Hey, buddy, here's the deal. We're in the emergency department because we're nervous about your safety. And so what these guys are asking you to do is write down your goals for how you're going to keep yourself safe. You've probably written down goals before, right? Basketball, baseball, whatever. So we're writing down some goals. Like, how do you get better at basketball? Well, you do this. How are we going to leave here? And what's your plan to feel better and to stay safe? And I just started narrating it because when I looked at the form, if I hadn't worked in healthcare, I don't know that I would know what the form was even saying. And so I thought, oh my gosh, they just handed this 15-year-old some medical language form and told him he couldn't leave the emergency department until this plan was filled out. Well, no wonder he escalated. He just gave him an impossible task with someone else's language. So I think that's a great example of where when they say, oh, it has to be this way, you can say, I hear you. I wonder if I could help with that. You can be, and just because I think our goal as the adult advocate in the room is we're not against the healthcare professional. They're trying to help too, but we probably know that kiddo and we might actually speak more teenager than they do. And so I would just, at all those, you can just suggest those. Could I help? I have a thought. I wonder if. I have an idea. Could we think about this together? All of that's very collaborative language, which will help de-escalate everyone. And I think that what you'll be seen as that adult is like, okay, I've got a mature, responsible, engaged adult of this kiddo. That's something every healthcare provider would dream of having, and certainly not every child presenting to an ED has that in their court. So reveal who you are and be engaged and be a problem solver with them. They will be responsive usually.
That is great advice. Thank you for sharing that. Anything you'd like to add on that?
Kate made some really great points on altering the language when we go into a setting that is already scary. Like I keep saying, it's traumatic, it's scary. We don't know what to expect. And all of a sudden we get words bombarded at us that we can't even process. Like we don't know what that means. We don't know if it applies to us, if it's just a medical term. Like you really need to break down and use simple, basic language when you're talking to us, like you are talking. I don't want to say don't use a child's voice, but when you talk to a child, you don't use exotic language that of words that they don't know. It's the same thing when you come into an emergency room or any other mental health crisis. You have to talk to language that they understand. When they are understanding what they're going through, what's about to happen, what you're asking them to do, it is much easier for them to process it themselves and say, okay, I can see why this needs to happen. In Kate's situation, the teenager just probably felt like um, there wasn't an option. It came off a little bit more hostile. It wasn't the delivery, it wasn't proper. So when you are delivering different news and tasks and asking people to fill out different things in a mental health crisis, you really have to get down onto their level, talk with them about it. Don't seem like you are dictating it or anything like that. It's just you really have to figure out how to collaborate with them, just like Kate said. Just you have to get down on their level is really what I have to sum it up and say.
Thank you, Anna. So moving on more to other resources and support systems. Are there any that attendees should be aware of both during and after their ER visit to be able to manage their mental health crisis effectively?
So ideally, when you're having that emergency department visit, in addition to nurses and physicians, you should be able to ask for a case manager or social worker. And it's fair to ask for one for both the child and for the adult, because the adult's also being impacted, and it's hard for you to help take care of your child when you're processing your own emotions. So don't be afraid to ask for what you need if those resources are available. They want to support both parties, because in that situation, you need some care as well. I think that asking for some of the clinicians, particularly the attending provider's phone number, most often they or the case manager taking care of you and that ED will follow up in 24 hours. But if they don't, I would want each of you to have their phone number for you to make an intentional call. And you can even say, I'd wonder if I can have your phone number or your phone line. I'd like to call and chat with you within 24 hours to give an update, to really talk about next steps, because sometimes in the moment you can't process all, you're processing what's happening right now and if you're going to get home tonight. And so I think having that follow-up call, and I've always had the experience where they will follow up, even if it's a game of phone tag, someone will try to follow up, which is helpful. Do talk with your school, right? You do want your school counselor to be aware. Let's be upfront that our schools are also really challenged right now. So I know I've found when talking to schools, just be able to say, if my kid or someone else's kid needs a break, like if they're feeling, can we talk about how they can come to your office and have their own mental health break? Or like, I want to have some tools on board and I want to talk with you about it as they're re-entering, but before they have that need, so we're not scrambling with what that looks like. So I think calling the school, talking about it, and narrating, I'm thinking this child might need a couple breaks during the day, or if he or she needs something, what can it look like, so the kid knows what they can count on when they go back, versus again scrambling. And then always, if you have a licensed therapist or another provider that you typically see, I'd say call that office as soon as you can, get back in to be re-seen and sort of talk about that and do whatever you need to do to re-stabilize, whether it's medication or talking with a therapist. So really kind of that follow-up care. But I try to leave an emergency department visit for whatever with a phone number that if I don't hear from them, I'm going to call them in 24 hours to just sort of double check. It's almost that read back again. I heard this, I'm seeing that. Here are my next steps. Did I get that right? It goes back to advocacy. You advocate for you. Yep.
So, you've shared a lot of great and valuable advice. And is there, kind of to bring all those things together, do you have a success story you'd be able to share from an example of a situation where the proper understanding and preparation for an ER visit in a mental health crisis led to a positive outcome?
I do. I was helping. I was helping a friend. She got a call from the school. Her kiddo was having suicidal ideations. Asked me to go along with, pick up the kiddo and go. And the child didn't want to get in the car. Was screaming at both of us about going out of school. So there was just even getting the kid in the car, and then we got the teenage silence. And so I just started to narrate and say, hey. So I think narrating what's happening. Hey, I understand you might be really mad at us right now, and maybe even a little scared. I'm not going to name your feelings. I'm just imagining that's what they might be. Here's why we're going to the emergency department. I don't need to go to the emergency department. Maybe you don't, but we're going to go do that because we love you and care about you. But I want to tell you a little bit about what's going to happen there because I love and care about you. I want to tell you a little bit about it. So I started narrating. We're going to check and we're going to park. We're going to check in at the front desk. There's going to be guards at the front desk. That's true too, right? We're going to have to name why we're here. So I just went through that process. They're going to separate us. So just like I started at the beginning, I started narrating that. And so then as it started to happen, the child sort of looked at me and said, how did you know? And I said, well, because what's happening to you is going to feel really personal. It's actually what happens to everyone who, so again, I'd already sort of used that car experience to just sort of connect, talked about safety because we care about you, all these sorts of things. And then as the experience went along, I was also able to just draw on, I know this is taking a long time. I'm frustrated too, but we're here because they're trying to help you. So I just kept trying to reaffirm through the whole process. Now, it never hurts when you get to leave the emergency department and go get a burger and shake afterwards. Let's just acknowledge that. That was fun, but it was also a time to leave at midnight, talk with the kiddo, and then say, okay, so let's do this. And then when we wake up tomorrow morning, like, how do you want me to be with you tonight? Are you okay this evening? What does that look like? Okay, when we wake up in the morning, we're not going to go to school right away, right? We're going to talk about the plan, and just sort of was very slow, methodical, intentional, narrating everything that I could for the kiddo and the family. And it lent itself to, I think, some authenticity for, I see how you're feeling. It's understandable. This is what's going to happen. You can trust me, because I could give them a little bit of like the why. And then certainly this is the particular kiddo that I leaned into and helped narrate that care plan for. So just, I think, really sort of walking it with them. Now that's tough to do when it's your kiddo, right? So some of that's putting aside your own feelings and trying to walk it. But in that moment, it is all about them. It is all about them. So I mean, and so that was a success story because that kiddo ended up seeing that all of that was about love and care. And even though like the school called, a parent and had to come and get me, and I said, yeah, what would you have them do? What would be a different approach for them? So just kind of getting them to think about, yeah, it sucks. It does. What do you think the alternative would be? And so they could kind of see that. So I tried to really just narrate the process. And I think as much as any of us can narrate those processes, put some whys, find some positives, and just really authentically connect. The kid then ends up, this particular kid now knows, right, that, I mean, healthcare providers are there to help. And we use them not because we're weak or there's something wrong with us or any of that. It's because, right, it's an illness. And when we have an illness, we go to the emergency department or the doctor's office. And it is about safety and health. And so I think just the more we normalize that discussion, even when we're in the middle of it, even though it doesn't feel very normal, you can lead to a better outcome and sort of acceptance of what they're going through.
Well, thank you so much, Kate. I appreciate that. That's a great story that encapsulated all the advice you were sharing. Yeah. We're getting close to the point where I think we'll open it up to see what questions some of our attendees have. Let me pull it up. There is one, and I'm gonna just read it straight. So make sure your question, it says, is there any way to quickly alert staff if your adult child's, quote, in their 20s is slipping into psychosis or it is getting worse? for example, some universal sign that might mean you need help to settle your child. Asking because I have been multiple times in an ER, and after 3 to 4 hours, my son has gotten up and run out.
So you've alerted the healthcare professionals and suggesting that they're not getting a response to that?
I think she's giving the example that when she's taking, is there some universal sign that might alert the caregiver of something that is getting worse? Because of her experience saying that her child, after being in our 3 to 4 hours, they just get up and leave. Is there a way to quickly alert staff if your child is slipping into that, psychosis, or is just getting worse, is what
I can't
her
think
question
of any
is.
sign, like if we're talking about like a hand signal or a certain verbiage, other than literally going and getting the professional and saying, I need help right now.
Okay.
And I think that honestly, you do not need to be quiet about your child's healthcare needs. If it's opening the door and say, I have an emergency, I need your help right now, my child is slipping, and saying it loudly and sort of abruptly in order to get attention, that's okay. So I mean, I wouldn't hesitate to say, I need someone here right now. Something's not wrong with my kid, and saying it really loudly and abruptly. You can hear me changing my tone. Call attention to yourself and your kid's needs. Make it, and it's because, right, we've got all sorts of other signs in healthcare. People hooked up to machines to see their blood pressure decreasing, to see whatever. We can't see that on a machine. So if you can see it, I'd say alert us in a very abrupt way. You will not be considered rude. You'll be considered helpful and an advocate.
Well, thank you so much, Kate. We're honored to have you here today and sharing some very important and great advice. I think we're here, getting to the time where we are finished with all the questions. And so again, thank you on behalf of NAMI Central Texas. We're honored to have you here. I also want to thank Anna and Ricky for joining us today, and then Anna for her insight as well, from not only being someone who works in the healthcare space, but her lived experience. So we appreciate you. And so I'll pass it over to you, Anna, if you want to share some announcements.
Yeah, absolutely. We have a lot of really great things going on at NAMI Central Texas right now. A couple of the things that we should touch base with first and foremost is that we offer a lot of peer support, whether it is for the individual who is living with a mental health condition, such as myself, or it could be a loved one or a family member. So Kate, as an example, she could refer her friend to one of our family support groups. So we have a couple different things going on where we are here to aid and support and advocate for anyone who is affected by a mental health condition. Through those support groups, we have different classes, we have different presentations, we go out in the community and just talk and educate and break the stigma that surrounds mental health. We have the weekly support groups. And then in addition, starting in September, we are doing 8-week courses for family members and also for peers. So we have a lot of really great things that are coming up. And then in addition to that, we also have our walk coming up in late September. It is September 30th. We have our annual walk where we all get together. We start at the Long Center, we walk to the Capitol, and it is just a really great time where we can all come together, share our voice, make it stronger, and talk about mental health.
Yeah, we'd love all of you to come join us. You can register or sign up for that walk at namicentraltexas.org//walk. Again, thank you, everybody, and enjoy the rest of your evening. Appreciate you all.